Joyce had just finished folding the last towel that morning. She stood in the kitchen, like she always did, preparing her tea. At 81 years old, she still lived independently. But that day, something changed. Out of nowhere, a headache hit her. Sharp, crushing, unlike anything she'd ever felt before. "It felt like a lightning bolt struck my head," she later said. Her daughter, luckily visiting at the time, noticed the way Joyce suddenly held her head and stumbled. They called 911, and thanks to fast treatment, Joyce walked out of the hospital just 2 days later. Not everyone is that lucky. What if Joyce had been alone? What if no one had recognized the warning sign? Would she have made it? The truth is, stroke symptoms in women are often missed. They're dismissed as tiredness, brushed off as stress, or blamed on age. But that kind of thinking can cost you, or someone you love, everything. That's why today's video matters. We're going to walk through the 7 warning signs of stroke in women. Some are easy to spot, others are subtle. But knowing each one could save a life. Because here's the thing. The sooner you recognize a stroke, the higher the chance of recovery. Instead of facing months of rehab or permanent damage, early action gives you a shot at full independence. So before we dive in, let me ask, would you recognize a stroke if it happened in your own home? Let's make sure you can. When most people think of stroke, they picture an older man clutching his arm or slurring his words. But here's something that might surprise you. Women are not only at equal risk, they're often at greater risk. And the danger isn't just the stroke itself. It's the fact that many women, and even their doctors, miss the early signs. So why is stroke more dangerous for women? First, women tend to live longer than men. That means they're more likely to face age-related health risks, stroke being one of the biggest. But it's not just about age. Women also face unique risk factors that men simply don't. Things like pregnancy, preeclampsia, taking birth control pills, or going through menopause, all of these can increase the risk of stroke. And then there's the real kicker, the symptoms. In women, stroke can look different. Instead of the classic signs you might expect, like facial drooping or sudden numbness, a woman might just feel unusually tired. She might get confused. She might seem off, but not obviously sick. And that's where the danger lies, because if you don't recognize it, you don't act. And if you don't act fast, brain cells begin to die. Minute by minute. Here's the difference. Instead of thinking, maybe she's just tired, we need to think, could this be a stroke? Instead of waiting, we need to call for help. Right away. The American Heart Association confirms it. Women have a higher stroke death rate than men. But that doesn't have to be your story. The truth is, most strokes can be treated. Many can be reversed if caught in time. And that's exactly why this matters. Because the power to change the outcome, to save a life, is often in the hands of the person who notices the signs first. Could that be you? Let's find out. Sign number 1. Sudden weakness in the face, arm, or leg. Imagine reaching for your coffee mug and realizing your hand won't cooperate. Or smiling at your grandchild and noticing one side of your face isn't moving. These aren't just odd moments, they're urgent red flags. One of the most recognizable signs of a stroke is sudden weakness or numbness, usually on one side of the body. For women, this can come on like a wave. One minute everything feels fine, the next your leg buckles or your arm feels heavy and distant. A quick test? Ask the person to smile or lift both arms. If one side of the face droops or one arm starts to drift down, It's time to act. Fast. Because here's what's at stake. Instead of brushing it off as fatigue or a pulled muscle, recognizing this weakness as a stroke symptom can mean the difference between full recovery and lifelong disability. Don't wait. Time lost is brain lost. Sign number 2. Trouble speaking or understanding. You're in the middle of a sentence, and suddenly the words won't come out. Or someone is speaking to you, and it's like their words are underwater, muffled and confusing. This isn't forgetfulness. It's not just a senior moment. It could be a stroke attacking the part of the brain responsible for language. Women may be more prone to this kind of symptom. They may speak in jumbled phrases, use the wrong words, or be unable to understand even simple questions. A friend may ask, "Are you okay?" And the response is gibberish or silence. Instead of assuming it's confusion or stress, stop and ask, could this be a stroke trying to silence her voice? Speech changes are urgent, and if noticed early, they can be reversed with proper treatment. Sign number 3. Vision problems in one or both eyes. Let's say you're reading the morning paper, and suddenly the words go blurry. Or you look up from your knitting and see two versions of the same object. Sometimes one eye might go dark completely. These aren't just signs of aging eyes. A stroke can interrupt the part of the brain that processes visual signals, causing blurred vision, double vision, or even sudden blindness, often in just one eye. The change can be subtle or dramatic, and it may last minutes or hours. And here's the scary part. Many women ignore this sign. They think, I just need new glasses, or maybe it's a migraine. But instead of waiting for it to pass, we need to recognize it for what it is, a possible stroke. The eyes may be the first to speak when the brain is in trouble. Listen to them. Sign number 4. Trouble walking, dizziness, or loss of balance. You're walking across the living room, and suddenly, the room tilts. You feel lightheaded, maybe like you're on a boat. Or your legs feel like they've forgotten how to carry you. This isn't just vertigo. It's not low blood sugar. It could be the early stages of a stroke. The brain's balance center, located in the cerebellum, can be affected by a stroke, causing unsteadiness, dizziness, or complete loss of coordination. Some women describe it as feeling disconnected from their body or environment. Instead of thinking, maybe I got up too fast, ask yourself, why now? Why this sudden loss of control? If the answer isn't obvious, don't wait for it to become one. Call for help. Sign number 5. Sudden, severe headache, with no known cause. This is the one that sends chills down the spine. A woman once described it as a lightning bolt cracking through my skull. Others say it feels like an explosion inside the head, a pain unlike any other. This kind of headache isn't normal. It doesn't build gradually. It strikes fast, hard, and without warning. It may be a sign of a hemorrhagic stroke, where a blood vessel bursts inside the brain. Many women in our community shared stories of this moment. One said she'd never forget it. Another described it as the scariest experience of her life. They all say the same thing. It felt wrong. And it was. Instead of reaching for aspirin or lying down to rest, recognize this pain as a siren. Because unlike a tension headache, this one could change your life in seconds. Sign number 6. Unexplained fatigue or sudden exhaustion. You're not stressed. You slept well. But suddenly, you feel like you've run a marathon. Your limbs are heavy. You can't focus. You want to lie down and stay down. This is one of the most overlooked signs of stroke in women. Why? Because we're used to being tired. We often push through exhaustion, assuming it's just part of life. But sometimes that weariness is neurological, not emotional or physical. A stroke in certain brain areas can drain your energy in an instant. So instead of saying, "I'm just tired today," ask, "Is this the kind of tired that rest doesn't fix?" If it comes out of nowhere, and especially if it's paired with any other symptom on this list, take it seriously. Fatigue shouldn't be fatal, but ignoring it can be. Sign number 7. Sudden changes in behavior or mental clarity. Your loved one seems off, not herself. She's confused, forgetful, or acting out of character. She might not know where she is. She might get emotional or aggressive without reason. Or she might freeze when faced with a simple task, like choosing clothes or making toast. These aren't just signs of old age. Sudden changes in cognition, personality, or judgment could point to a stroke affecting the frontal or temporal lobes of the brain. And women, especially those over 60, may experience these soft signs more often than men. Instead of dismissing it as mood swings, ask, could this be her brain crying for help? When the mind shifts suddenly, it's time to stop and respond. Because mental confusion might not be a phase, it might be a medical emergency. Recognizing these signs isn't just about information, it's about action. When a stroke strikes, every second counts, and the more you know, the faster you can move. When a stroke strikes, time isn't just important, it's everything. There's a treatment called TPA, short for tissue plasminogen activator. Some call it a clot-busting drug. And when given in time, it can reverse a stroke completely. It's not science fiction. It's been saving lives for years. But here's what most people don't know. TPA works best when it's given within the first 3 hours. That's the golden window. The sooner it's administered, the better the chances of walking out of the hospital with your life, your speech, and your independence intact. And here's where it gets even more promising. New studies from 2025 show that, in many cases, TPA may still work up to 6 and even 24 hours after symptoms begin. That means we've got a longer shot at recovery, especially in communities where getting to a hospital fast is harder. But there's a catch. You can't get TPA if no one knows you're having a stroke. You can't get it if you wait, or sleep on it, or tell yourself, "I'll see how I feel in the morning." That's why recognizing the signs and acting fast can literally unlock the door to recovery. In some cases, hospitals now use tenecteplase, a newer drug that requires just one injection. It's easier to give and comes with fewer bleeding risks. One woman, Joyce, was treated with tenecteplase and was walking again the next day. Imagine that! What felt like a death sentence turned into a miracle within 24 hours. So here's what you need to remember. TPA, 3 letters, one powerful chance at life. Some people remember it with a silly trick. TPA, toilet paper, always. It doesn't matter how you remember it. Just make sure you do. Because when stroke happens, you don't need to know how to treat it, just where to go and when to go. And the answer is always right now. Here's something powerful to remember. Most strokes are preventable. They don't have to sneak up on us. They don't have to steal our memory, our mobility, or our independence. We can fight back, starting right now. But how? Start with your blood pressure. High blood pressure is the single biggest risk factor for stroke. Instead of letting it quietly damage your arteries over time, you can take control. Check it regularly. Talk to your doctor. Adjust your diet. Stay consistent with medication if prescribed. Next comes blood sugar. If you have diabetes, or even pre-diabetes, your stroke risk increases significantly. But again, this isn't out of your hands. Eating fewer processed carbs, moving your body a little every day, and staying on top of your glucose levels can all make a difference. And let's not forget cholesterol. Too much of the bad kind can clog arteries in your brain just like it does in your heart. So instead of skipping those follow-up visits or ignoring numbers on a chart, see them as signals, opportunities to protect your future. Then there are the lifestyle choices we often know, but sometimes ignore. Smoking, heavy drinking, a sedentary lifestyle. Instead of saying, "It's too late to change," tell yourself, "It's not too late to stay alive." Even small steps count. Choose more fruits and vegetables. Go for a walk after dinner. Take the stairs when you can. And most importantly, know your numbers. Know your body. And speak up when something feels wrong. Because prevention isn't about perfection. It's about intention. And the decision to take one small step today could keep you walking, talking, and living fully for years to come. So now you know the signs, you understand the risks, you've seen how time, and just a little knowledge, can make all the difference. But before you go, take a moment. Close your eyes and picture someone you love. Your sister, your mother, your best friend, maybe yourself. If a stroke happened to them, would they know what to do? Would you? Because that's the real reason this video matters. Not just to inform, but to empower, to help you recognize the early whispers of a brain in trouble, before it screams. Instead of living with regret, you can live with readiness. Instead of saying, "I wish I had known," you can say, "I'm glad I did." And if today's message reached you, really reached you, then don't keep it to yourself. Share this video with someone who needs to hear it. Maybe it's your walking partner. Maybe it's the friend who always says she's just tired. Maybe it's your daughter, so she can watch out for you. You could save a life just by hitting that share button. And if you've experienced any of these signs before, or helped someone who has, we want to hear from you. Leave a comment. Your story could help someone else finally connect the dots. Lastly, before you leave, stick around for 2 more videos coming up. We've got more life-saving information on stroke prevention, blood pressure, and how to spot the signs of a mini-stroke before it becomes something worse. Stay informed, stay alert, and above all, stay healthy.